Since the COVID-19 pandemic began, treatment for other illnesses like eating disorders has been delayed. Now, in the second part of his series, Global's Sean Previl looks at how limited access has created a dire situation and the calls to do more.
As COVID-19 spread through Canada's hospitals, it forced many to shift resources. That included resources for the treatment of eating disorders. Hospitals like Sick Kids in Toronto reported a doubling of patients waiting for referrals of up to 6 months, with some reporting even longer. But Chris Bartha with Sick Kids says lengthy delays for treatment are not just a pandemic-era issue.
I would say wait times have always unfortunately been a challenge in child and youth mental health and in eating disorders. The pandemic has definitely amplified the problem.
15-year-old Jay Foley went through a wait of their own as they dealt with anorexia nervosa during the pandemic. They started searching for help in March 2020 with their parents, and while they started a program at the end of June, Jay and their mother Pam Devins question why such a wait exists.
The longer they wait for treatment, the harder it is to treat. So that eating disorder is digging in like a tick with each passing month.
Any situation where it is implied that you aren't sick or sick enough, your mind will immediately just start attacking you and sabotaging any progress you've made.
According to the National Eating Disorder Information Center, during the pandemic, people have reported wait times ranging from 6 months even up to 2 years. The federal government is studying the impact eating disorders have had on Canadians during the pandemic, but the delivery of treatment is still up to provinces and territories, and that support is a patchwork of help, leading some patients to seek private care or go out of province, creating more delays. BC, Alberta, Saskatchewan, Manitoba, Ontario, the Yukon, Newfoundland and Labrador, and Quebec offer a mix of inpatient and outpatient treatment. New Brunswick, Nunavut, and the Northwest Territories have no direct treatment, but along with the Yukon will cover patients who need to travel elsewhere. Prince Edward Island and Nova Scotia did not provide details on treatment available before deadline. Ari Maharaj works with the National Eating Disorder Information Center and says more funding is needed to improve the quality of service and spot issues faster.
We should be able to give people care just like how we do for the flu or any other kind of illness in their community right when they're noticing it.
And healthcare professionals warn they need to be prepared for future crises so they can help youth and children as soon as possible. Sean Previl, Global News.